Right now on Up with KREM, Idaho hospitals cannot take any more strain.
We do not see a peak in sight.
This morning, what crisis standards of care means for Idahoans. And this morning, we are honoring Hispanic Heritage Month on Up with KREM. We're telling stories from one of the first Hispanic communities in Washington.
The access to health care is another big issue, primarily to the farm worker community doesn't have access.
We're sharing how the community is making it through the pandemic by coming together and supporting one another.
We're going to take you outside as clouds return to the sky ahead of our next round of rain. I'll let you know when it arrives.
Up with KREM begins now.
Idaho hospitals are at their breaking point. Upon the announcement of crisis care standards, the Idaho Department of Health and Welfare tweeted that this is a last resort. They say everyone's care will now be affected. Thank you for joining us on Up with KREM. I'm Channing Curtis. The crisis of care standards for the entire state come just 1 week after they were activated in North Idaho. Right now, hospital beds, ventilators, medicine, and other healthcare supplies will be rationed for people that doctors believe are the most likely to survive. Director Dave Jeppesen says the front lines look like in hospitals right now.
Our ventilator use is at the highest level we've seen so far. As the numbers continue to increase, they continue to increase at an alarmingly fast rate, and we do not see a peak in sight.
Now, under the current conditions, Health and Welfare says patient transfers may not be feasible. So here are the 3 most important things that you need to know about crisis standards of care. First up, crisis standards of care is activated when hospitals get to a point where they just do not have enough resources. To put things simply, they can't provide the standard of care to every patient like they normally would. So what do we mean by a shortage of resources? Well, it could be anything from staffing to equipment. So if they don't have enough staff to treat the amount of patients coming in, or if there aren't enough ventilators to treat patients, hospitals also may have to conserve limited resources. For example, lowering dosages of medication. In most extreme shortages, resources may be given to patients with cases more likely to have a positive outcome. So what happens next? A shortage of ventilators, for example, might mean someone less likely to survive due to an underlying condition would not be put on a ventilator. Instead, someone more likely to live would get it instead. But to be clear, this is not necessarily what will happen. It's just a possibility. And it is mentioned in the Idaho Health and Welfare's plan as a general approach to consider when this is activated. Now, we know this is a lot of information, so to learn more about crisis standards of care and what it will mean for COVID patients and all patients in Idaho, you can text the word COVID to 509-448-2000. We'll send you the very latest information right to your phone. All right, the time is now 7:33. Let's go ahead and turn to the weather. Jeremy, listen, first of all, we finally made it to Friday, and I feel like we haven't said that enough today. This is a very exciting day. We made it to the weekend. It's here.
Yeah. And
remember, like TGIM?
TGIM is okay. TGIT is, tacos. And by the time,
tacos.
Yeah, by the time we make it to Friday, we're at peak serotonin levels of the entire week. I don't know if you knew that. And even more so than the weekend, because that anticipation is so incredibly high. So if nobody said it to you yet, as Channing mentioned, happy Friday, everybody. Happy Friday, we've made it. So let's get you out the door and let you know what to expect as we all look forward to the next 2 days of doing absolutely nothing. Early on this morning, temperatures are remaining, in the mid-60s. Not too or mid-40s, excuse me. Mid-60s? Mid-40s. Holy moly, can you imagine? No, we're far from that. We're in the mid-40s early on today. It's a nice start to the day. Sandpoint sits at 37, but temperatures are set to rise. We've got a little bit of cloud cover moving in, so that cloud cover is what kept us from falling into the 30s like yesterday, and that cloud cover is associated with a storm moving into the west side, bringing some very widespread heavy rain to much of the coast. Now that rain moves over to us in a big way tomorrow. So I think tomorrow morning we have a much better shot at getting rain than we do this afternoon. This afternoon I think most of it's off in northeastern Washington, and a couple of stray sprinkles is about all we get. Then we get that push of moisture, a break, then another push of moisture, then the storm itself moves in. So it's on and off showers all weekend long, and today's kind of the calm before the storm. I know there's clouds, but it's going to be relatively calm, a little less wind than what we've seen, a little more cloud cover, and temperatures in the mid-60s means it's going to be about 10 degrees colder than where we typically should be this time of year. Coming up, though, we're talking rain and how much you're going to get this weekend.
All right, thanks, Jeremy. Well, it's a big day for some college students as students at EWU are moving into their dorms this morning. Nicole Hernandez is on campus to explain what the university is doing to make sure that their students stay safe all semester long.
Yeah, like you mentioned, move-in day is happening. Students will be moving into these dorms behind me, and they'll have the weekend to settle in before classes actually start on Wednesday. So EWU says that 960 students will be moving in between today and yesterday. All of them, though, will have to take a rapid COVID-19 test before starting the move-in process. If students test positive for COVID, they will have to go to specific isolation dorms for 10 days. They can also choose to go back home to isolate for those 10 days. EWU is also asking everyone to show proof they're vaccinated. If a student isn't vaccinated, staff will help them either ask for a religious or medical exemption, or they will help the student get their vaccine ASAP. If an unvaccinated student isn't working with the university, they could get a $250 fine. Of course, all of those logistics are to make sure students stay safe and can have class in person. And when we talked to the EWU president last month when a small portion of their students started classes, he said that as he's been talking to students, they've all been totally okay with these COVID-19 procedures because they're just excited to have class more normal and in person this fall semester. In Cheney, I'm Nicole Hernandez.
Hispanic Heritage Month started this week. Now, Hispanic Heritage Month brings unity for Latino and Hispanic communities in the U.S., and it gives an opportunity for everyone to learn more about their cultures. Our sister station in San Antonio is explaining how this all got started.
September 15th is the first day of Hispanic Heritage Month. It's a time to celebrate the history, culture, and contributions of American citizens whose ancestors come from Spain, Mexico, the Caribbean, and Central and South America. Now, the remembrance has not always been a month-long observation. It actually began in 1968 when President Lyndon B. Johnson signed the National Hispanic Heritage Week bill into law. Representative Esteban Torres of California proposed a bill to expand the observance, saying more time was needed to properly observe Hispanic culture and achievement. In 1988, the month-long observance was signed into law by President Ronald Reagan. President George H.W. Bush became the first president to declare the 31-day period beginning on September 15th, Hispanic Heritage Month. September 15th is significant because it's the anniversary of independence for Latin American countries Costa Rica, El Salvador, Guatemala, Honduras, and Nicaragua. Mexico also celebrates its independence on September 16th, or 16, followed by Chile on September 18th.
Now let's share some numbers with you. According to the U.S. Census, 60.6 million people in the U.S. identify as Hispanic. It's the nation's largest ethnic or racial minority. 12 states had a population of 1 million or more Hispanic residents in 2019. And the number of U.S.-owned businesses by Hispanics has grown from 2.3 million to about 3.3 million from 2007 to 2012. Hispanic Heritage Month runs through October 15th. Now, right here in Washington, in the lower Yakima Valley, the town of Wapato has a rich roots in Hispanic heritage. The community was hit hard by COVID-19. Entire families got sick while working as farm workers, and many small businesses closed. Efrain Martinez knows about that community because his parents were a part of it, and from a young age, he was working on the farm right beside them. He and his partner renovated the building for their new business, Fiddle's Coffee House and Juice Bar, right before the pandemic hit.
Every day, gloves, cleaning, fixing.
It did slow down quite a bit, like a lot.
Now, they've been able to push through the slow times, and their focus right now is on their community's future. After 9 years of knowing each other, they've become partners in business and partners in life.
I think we like to paint a better image for people to see that it's not what they think a stereotype, especially for Hispanics and Hispanic and being part of the LGBT community. People feel more comfortable and understanding of who we are now, and they don't mind it, and it's just Wapato growing.
The couple says they hope that in 5 years, the boarded up buildings in Wapato will become new small businesses like theirs. Now, if you're looking for a way to celebrate Hispanic heritage this weekend, Latinos in Spokane is hosting an event to help the community and to get you some delicious food as well. On Sunday from 1 to 4 p.m. at Chuchu Tortas restaurant in Spokane Valley, the organization will be administering COVID vaccines in partnership with Providence and Walgreens. Now, the address for the event is right there on your screen. And coming up later this morning on Up with KREM, Latinos in Spokane will be on our show to talk about the event and Hispanic Heritage Month. With the Delta variant of COVID-19 impacting more and more children, a lot of you have reached out to us to ask if minors need their parents' consent to get vaccinated in the state of Washington.
As a child, a minor in the state of Washington, do they need their parents' consent to get a vaccine, specifically the COVID vaccine?
Yeah, so for all vaccines, generally the answer is yes, they need parent consent if they are under 18.
Coming up a little later, we'll verify when a minor can get care, like a vaccine, without their parents' consent.